Hi, everyone. Welcome back to Long COVID Real Talk. This is Katherine Marie, and I am a nurse practitioner and a social worker, and I'm also someone who is living with long COVID. So thanks for being here. Today, we're going to dig into something that comes up a lot in both medical settings and daily life when you are living with a chronic illness, and that is depression. But here's the twist. We're going to talk about it from two directions. First, depression that develops as a result of chronic illness. And then second, depression that might contribute to or even precede chronic illness. So first, let's acknowledge something real. Depression and chronic illness often go hand in hand, but the direction really, really matters. If you've ever been told things like you're anxious, it's probably stress, you need antidepressants before we do more testing, then you already know how this can play out. It's dismissive, it's invalidating, and sometimes it's dangerous. And at the same time, mental health and physical health are deeply connected. Our bodies and brains talk to each other constantly, and that doesn't mean that your symptoms are all in your head. It means that everything is in your body. The second part, depression and chronic illness. Let's start with the more familiar version of depression. Depression as a result of chronic illness. When you're dealing with long COVID or any chronic condition, life changes. Maybe you've lost your job, your identity, your energy, your sense of control. Maybe you feel isolated physically, emotionally, socially. Maybe you've been gaslit by your doctor or ghosted by friends who don't understand what you're going through. All of this can lead to what we call situational or reactive depression, a mental health response to a very real, often traumatic life event or events. It is not a personal failure. It's a normal human response to chronic suffering. And the treatment? Often it involves validation, community, trauma-informed therapy, and sometimes medication, but always an approach that recognizes the grief and loss that come with chronic illness. So let's flip the script. So what about depression contributing to or even preceding chronic illness? This can be more complicated, and it's where people sometimes feel shame or get misunderstood. Long-term untreated depression can cause an increase in inflammation. It can mess with your sleep cycle, it can disrupt your immune system, and it can contribute to physical changes that can make your body more vulnerable. It can make recovery slower, it can make pain feel worse, and even in some cases play a role in developing chronic illness. But that does not mean that your symptoms are just depression. It means your brain and body have been under stress for a long time, and stress is not neutral. This is especially important in long COVID. Some people had mental health struggles before they got sick, and some did not. And now they're being told that their physical illness is just mental health. That is a huge problem. Both can exist and both matter. Okay, so the medical harm and misdiagnosis. So let's talk about the harm that happens when this distinction is missed. Too many people, especially women, people of color, and people who are disabled, are told that their physical symptoms are just anxiety or just depression. This can delay diagnosis, delay treatment, and destroy trust in the medical system. In long COVID, this has been devastating. People with neurological symptoms, fatigue, shortness of breath, they've been sent to psych before anyone looked at their heart or lungs. Let me be clear. Mental illness is real and deserves our care, but it should never be used as a reason to ignore physical symptoms. Quick story from a listener. They wrote, "I was told my breathlessness was panic. I kept saying, but it happens when I'm not panicking. It took 18 months before someone finally ordered a pulmonary function test. It turned out I had permanent lung damage." This is one of many stories, and you're not alone if this happened to you. So, what do we do about all of this? First, we need to validate both physical and emotional suffering. They are not mutually exclusive. We need to use trauma-informed mental health care that takes chronic illness seriously. We need to advocate for integrated care because your brain and body are not separate systems. And finally, we need to tell our story. Whether to a doctor, a friend, or just a journal, your story matters. And if you are a provider listening, ask yourself why you're reaching for a psych diagnosis. Is it to understand the patient or to move on to the next one? Finally, living with long COVID, or any chronic illness can feel like you're walking through fog with no map. And in depression, it's like the fog gets even heavier. But understanding where that depression fits, whether it came after, before, or both, can help you figure out the path forward. And remember, none of this is your fault. You didn't cause this, you're not imagining this, and you're not alone. Thank you for listening, and we'll talk again real soon.